Therapy, it may begin on your day of surgery. It depends on what time your surgery is. If you're an early case and we get you up to the 6th floor before lunchtime, chances are the therapy folks are going to come see you that afternoon. If you are a later case and you don't come up to us later in the day, they will get to you the next morning. I promise they will not forget you. But the staff on the 6th floor are expected to get you up and get you moving around, have you up to a chair, have you up to the bathroom, and that sort of thing. But the physical and occupational therapy people will come see you the next morning for sure. What can you expect us and them to work on you with? The first thing we're going to do is sit you on the edge of the bed, make sure you're not dizzy, make sure you're okay. If that's all right, we're going to stand you up. Again, make sure you're not dizzy, that you're bearing weight okay. And once we see that that's fine, that's when we'll start taking steps. And I will tell you, most back surgery patients, they're anxious about getting up and getting out of bed, but once you're on your feet, I think you'll be surprised it's not as bad as you maybe anticipate. Occupational therapy will also work with you, and what their big job is to help you with your activities of daily living, with adaptive equipment to help you get dressed, to help you shower, help reach things that you may need to use. They'll talk about different home strategies so you can get back to your normal life as quickly as possible. They will also supply you with some tools that actually come out of their own budget. It doesn't come out of any type of insurance of your own. Different types of adaptive equipment. I always encourage patients to take every bit of that home. There's nothing worse than getting home and thinking, oh man, I could have really used that. I can't believe I left that at the hospital. So what they bring to you, just go ahead and take it on home. I'm sure you'll find a use for it. They're going to teach you little tips and tricks on how to get dressed and all kinds of stuff that'll be helpful once you get home and on your road to recovery. Which leads me to, what should you bring to the hospital? What should you be wearing? I always say something very comfortable, something loose, especially to the ladies. Don't bring your best pajamas or your most expensive silk whatever, because you have had surgery. There may be some drainage, and I don't want you to ruin something that's very nice. Usually, I recommend a top and shorts because we'll have to be looking at your incision, assessing it, and making sure everything is okay. So usually 2 pieces are best, but anything that's comfortable is just fine. As far as footwear goes, it may seem logical to you to have something that's easy to slip your foot into and out of, but actually that can be a tripping hazard. We would prefer that you wear something that has a good grip on the bottom and at least some sort of lip on the back to help hold your heel in place. We don't want your foot to come out of any of your footwear, become a tripping hazard, and lead you to having a fall. Other little things I do like to mention, we are able to provide your medication for you so you don't have to bring your home medications, but you are more than welcome to bring a cell phone, iPad, tablet, book, laptop, whatever you want to use to help entertain yourself while you're here at St. Joseph Hospital. I do recommend any expensive jewelry or anything like that you may leave that at home. As much as we like to help you keep track of your things, we can't always promise that we can, and we don't want anything precious to get lost. Something else I do want to point out is you may or may not need to wear a neck or a back brace. Very frequently, your surgeon will not know the answer to that question until he or she is doing your surgery. If they do, in fact, think that you need a back brace, they will let the nursing staff know. We will get that ordered and delivered to you. There are some folks who already have back braces. If you do, please bring that to the hospital with you on your day of surgery. What does a back brace do for you? A couple of things. Back brace or neck brace, either way, helps provide a structure for you when you're standing up and moving about, so your muscles that have been disrupted during surgery don't have to work so hard on their own, and it helps prevent as much fatigue when you're up moving about or even sitting up in a chair. We do recommend that if you're going to be up for an extended period of time, if you're going to be in a car, if you just feel like you need some extra support, that you do wear your brace. When do you not have to wear your brace? If you just get up to simply go to the bathroom and go back to bed, it's not necessary. If you're just getting up to maybe sit down and eat a quick lunch, you don't have to put your brace on. And you certainly don't have to wear it to sleep. That'd be pretty uncomfortable. One thing I do want to point out is that the back brace, again, is for support. It does have some counter pressure, which does help with some pain, but it is not designed to be the be-all, end-all protector of your surgery. What your surgeon has done and the instrumentation that they have used is very, very strong, and they will stand up on their own. So the back brace or neck brace is really more for support and pain management.